Let's go now to Dr. Bharat Pankhania. He's a professor at the University of Exeter Medical School, and he joins me now from Bath in the UK. Thank you so much, Doctor, for joining us on the program. Now, first off, tell us why it's important that children get vaccinated, even though the population of that age group dying from the virus or getting seriously ill is rare.
It's a very important question, and we must address it because prevention is always better than the wild infection. And if we have the tools, the means, the ability to protect and prevent infection in our children, then we must use it. So whilst the infection in the children may, in most cases, be okay, it is not okay in all cases. And as your report indicated, some children do end up in hospital, and unfortunately, some children also die. The further important measure also is that if you suppress infections in all age groups, it reduces the number of viruses in circulation, and it also reduces, as the Johns Hopkins report clearly shows, the emergence of variants of concern.
Right, and children have often been described as one of the main sources of spreading the virus, especially when attending school. How much more quickly can we stop this pandemic if more children get inoculated?
Well, it's a double-edged thing. It's not only the children, but children as well as adults in other parts of the world where they've received no vaccines. So one way to end the pandemic sooner is to immunize places like Africa and Asia, where the coverage is pretty low. In the affluent nations, because they have got all the vaccines, they can do what they like with the supplies that they can buy. Then, of course, if they can, it is a good thing to also immunize the younger age groups.
Right. I think it's understandable that parents would be hesitant to go through with vaccinating their children. What would you say to those parents who decide to stay on the safe side, as they would describe it?
Well, these vaccines are not deployed without putting them through trials. So the trials have been done by Pfizer-biontech, and the vaccines have been found to be very good, very, very good in eliciting a good immune response with the doses given. And it is protection, it is prevention, it is, on balance, a better thing to do, immunize, rather than risk a wild infection where we don't know what the outcome would be.
All right, Dr. Bharat Pankhania, thank you so much for joining us on the NewsHour.